suspects, mostly children, today were arraigned before a federal high court for attempt to overthrow the government in the aftermath of the August nationwide protest. And the Tinubu government is talking about an elaborate health agenda for Nigeria. We're finding out from the minister tonight the plans and the strategies on how this will impact on the average person in the country. Hello everyone, welcome to the program. This is Politics Today, live on Channels Television. I'm Sean Kimbaloye in Abuja. We begin tonight by giving you some insight into what has become a major concern from a lot of Nigerians, some of them who have been debating on the right of a child. So some suspects brought by the Nigerian police for arraignment fainted before Justice Obiora Egwuatu Court at the Federal High Court in Abuja today. The suspects, about 75 of them in number, between the ages of 12 and 15, are being charged with 10 counts of terrorism and attempt to overthrow the government and alleged mutiny over their participation in the nationwide protest. They were allegedly arrested on August the 3rd and had since been in detention before they were brought to court today. The case before the court was for arraignment and plea when some of the suspects were seen to have fainted right in the center of the courtroom, which made Justice Egwuatu rise abruptly. And after that matter, this is what some of the lawyers said after the hearing today.
Boys that we brought to the court today, all of them are adults. Most of them are married men. None of them is a minor. Some of them are university graduates. The small kids you are seeing here, they came with some of their parents to come and greet their loved ones. They are not even the real suspects standing trial in this case. These boys were arrested in Kaduna and Zaria. These young boys are trying to destabilize Nigeria using the Russian flags and other countries, calling on the military to remove our president. Is it fair?
As you can see the videos that are flying around social media, they were kept at the Kuje Correctional Center and police and at the IRT, the notorious IRT at Sas Abatua. Now this is the facility that has held our young children that are being kept by this government over allegations of attempting to overthrow the president. The question now comes to how can a 12, 13, 14-year-old boy who is looking very frail and malnourished attempt to overthrow the president? That is a matter for another day.
These are some of the lawyers who spoke right after the court hearing today. So over 70 children were arraigned at the Federal High Court, and different arguments by the lawyers saying, well, some of them are not children, some of them are adults. There are serious charges against them, including 10 counts of terrorism, attempts to overthrow the government for their participation in nationwide protests. The case has sparked significant public outcry and heated debate regarding the appropriateness of trying minors in such a high-profile manner. And critics have also argued that the legal proceedings against these children violate their rights and fail to consider their age and vulnerability, while supporters assert that the gravity of the charges necessitate a firm response. The trial has raised crucial questions about the intersection of child rights and national security in Nigeria. Tonight, I'm being joined by one of those who are concerned about the welfare and the legal representation of some of these suspects. I'm being joined by Ms. Funke Adeoye, who is a human rights defender, social innovator, and young global leader. She's the founder and the executive director of Hope Behind Bars. Thanks so much indeed for joining us tonight.
Thank you for having me.
You've been working with the likes of Mr. Femi Falana, Dejare and Ju Chambers to fight for these children. But there seems to be some kind of communication problem here. The lawyers to the federal government in that matter, the lawyer to the state rather, said today that a lot of them are not minors. That some of them that we've seen in court today were they came with their parents and their adults. Is that true?
No. We were in court today observing proceedings, and you could clearly see children in court today. Also to say that this matter did not begin today. It began in August after the protest, when a number of people were picked up from different parts of the country, which included minors. A remand order, an ex parte order, was actually granted by Court 9 of the Federal High Court. And when you look at the remand order, the names of 75 protesters were included in that order. And out of those names, we had minors. Their ages were clearly written on the motion paper. So they were remanded ex parte for 60 days under the Anti-Terrorism Act. Now, immediately after the 60 days, we're expecting the government to charge or arraign this set of persons. But what we found out was just about 10 of the names that were in that motion paper were arraigned. And so the law firm of Femi Falana and Deji Adeyanju decided to file a fundamental human rights action to ask the government to do something about the children. We're in court last week, and the situation that happened today was an aftermath of the fact that fundamental human rights action was filed to say, where are these children? Because we and a lot of other advocacy organizations knew that indeed children were being arrested. We didn't know their whereabouts. Some of us had gone to Kuje Correctional Facility only to find out that they were at the IRT. So what happened today is an aftermath of the fundamental human rights action that civil society organizations and the law firm of these human rights activists actually filed. Okay,
so today is the first appearance, is the arraignment.
Yes.
The charges were read to them.
Yes.
And they, one after the other, they answer to their...
Not guilty.
Not guilty to the charges.
Yes.
What about the fundamental human rights action that was filed?
It's still pending in court, and we're still going to continue.
Okay, I mean, that means it might be taking pari passu with the matter, isn't it?
Yes.
Okay, now, let's look at it. Out of about 75, 75 people were brought to court today.
Yes, but...
Were there any adults there?
There were adults. About 38 of them were minors. About 38 of them were minors.
Okay.
Yes, but there were also adults.
Out of 75,
yes,
about 38 of them were minors.
Yes.
Okay. Now, give us an understanding, because I know there is a juvenile justice system in Nigeria, which also take cognizance of the Child Rights Act of 2003, isn't it?
Yes.
And it also says the procedure for which a child under our law, a child is less than 18 years.
Yes.
That's seen as a minor, can be tried in Nigeria courtroom. Were those procedures breached today?
So again, I will have to take us back to how we started, because it's not just today. It's the fact that these children have been kept in detention longer than they should be.
Unlawfully.
So they're unlawfully. So they are right to pass...
By the Nigerian state.
Yes.
By the Nigerian police.
Yes.
Isn't it?
Yes.
They've been kept in different police custodies.
Yes.
Alongside, were they kept in adult prisons or children prisons?
Their right to personal liberty and fair hearing under Section 35 and 36 has already been violated. Because...
But the fact that they've stayed longer than necessary.
Yes. Were they kept in adult? From all our understanding, they have been at the IRT. That's the Intelligence Response Team, which is colloquially known as abattoir. So imagine keeping children in a place...
Why is it being tagged abattoir?
I guess there are several reasons for that, but there are lots of stories about the kind of things that happened there. And when you see the children that were in court today, not only would you see malnourishment, not only would you see starvation, you would see fear in their faces. The
child that fainted, I mean, I assume there was a child from some of the pictures. Unfortunately, we're not permitted by the rules guiding our profession to reveal the faces of and that's why they are blurred in a manner in which you can see, you can see on the screen right now. The fellow who fainted is a boy, isn't it?
Yes.
How old is he?
From the motion paper, we have 14-year-olds, we have 12, we have 13, we have 15. So it's actually very surprising to me to hear the prosecution say the children that were in court today came to visit their parents, because even the police the child that fainted, even the police had to take some of these children. It wasn't just one child. Had to take some of them out to get some form of health care. Today, during court. Yes. So
not only that they were kept longer than necessary, they were also being, it looked, and the inference that you are giving tonight is that they were being badly treated.
Anybody that saw them in court today, anyone that saw the videos that are going around, you can see that these children are badly treated. They are malnourished. They look like they've been starved. I mean, some lawyers in court today had to crowdfund money to just quickly get food for them. That's how bad it was. That's how bad it looked today.
Now, there is an adjournment. The motion for their bail was moved today in court. And
I think we need to talk about the bail conditions as well.
Justice Eguatu agreed to the bail conditions, isn't it?
The bail conditions are very stringent. I mean, the provision of the law is very clear on bail. Bail is not supposed to be punitive. Dogo versus the state. The law is very clear on that. Now, these children who were supposedly being tried for treason and who were actually protesting against hunger and suffering in the land were given very stringent bail conditions, 10 million naira, 2 sureties. One of them has to be a civil servant of level 15, and a family member. I think that is really stringent, considering the fact that these children are coming from different parts of the country, different parts of the north, where it's obvious that they can't even feed well. By the way, some of them, their parents have been around as well, and their parents are residing in different uncompleted buildings across the country. Yes, because their children, I mean, they don't, for a while, they never knew the whereabouts of their children.
So is the fundamental enforcement proceeding that was filed, is it based on the Child Rights Act or based on the allegation?
It's based on the Constitution. The Constitution says everyone has a right to fair hearing, Section 36. Everyone has a right to personal liberty, Section 35. But these children have been kept in custody. I mean, an ex parte order was granted, like I mentioned earlier, for 60 days. But after the 60 days, they were not charged. They were not arraigned.
It's also the duty of the state to cater for a child.
Absolutely.
The reason why I'm asking is that, yes, you can file a fundamental enforcement suit in that regard of enforcement of the right of any citizen, which can be an adult or a child. But again, the perspective to this is the fact that any child that is found in this kind of manner, the state is responsible for every child under the Child Right. It's a failure of the state in the first place to find a child roaming the street on not in classroom and all that, and that's why I'm putting the perspective whether or not that is also included in the angle into the right of enforcement.
Absolutely.
Now, what is the next line of action now? It doesn't look like most of them can be able to meet those bail conditions.
Yes. Even as I speak to you now, there are questions as to where they are going to be remanded, because they cannot be remanded at Kuje Custodial Center because adults are the ones who should be there. So as I speak to you, they are taking them back to IRT. Is
there a juvenile center in
Kuje? No, Kuje
in Abuja?
None that I know of. Yes, I mean, the court has remanded them to Gwagalada. There's a Bosta home. The Bosta home, I know, the closest Bosta home I know of is in Kaduna. I think that also brings to bear questions around our correctional system. The fact that we actually do need Bosta homes across the country, because Kuje Custodial Center has rejected the children now because there's fear of, anything could happen, and they don't even have the mandate to hold children. Now they are going back to IRT. And there's also the question of the matter has been adjourned to January. If the children don't meet their bail conditions between now and January, where would they be? How would they be treated?
Well, I do not think that there is anyone who has a child, any parent in this country should go to bed tonight feeling all right that children, about 40 of them, are going to be kept in prison and are probably not going to be in their bail condition. This is a shame to our nation. Yes, I dare say. We need to look inwards and see. We need to feel our humanity. No matter what the offense is tonight, any of the child that is being kept in that prison today is a question on our humanity as a people. Over 200 million of us in this country, we need to be checking ourselves about our humanity and what power or the rights that we're giving to every child. And those of them who are facing trial today, thank you so much, Funke, for joining us. I appreciate your time.
Thank you.
We take a break, everyone, and when we return, I'll be speaking with the Minister of Health, Professor Ali Pate, about the health agenda and the implication for the average Nigerian. We'll be right back after this break, everyone. Join us again. Thank you so much, everyone, for joining us tonight. Well, the Coordinating Minister of Health and Social Welfare, Professor Ali Pate, says the federal government is set to release Nigeria's inaugural State of Health report. We're all anticipating what that will be and what is in that document, where Dr. Pate was speaking in Abuja on the planned health sector joint annual review, popularly called JAR. It says the report is a culmination of various surveys and data compiled by different departments and agencies under the ministry to gauge public perception of the health system in Nigeria. It says that the report would provide a baseline for ongoing health sector reforms, enabling informed decision-making and targeted interventions. The Minister, Professor Ali Pate, he joins us live here in our Abuja studio. Thanks so much, Honorable Minister, for joining us tonight.
Thank you for having me.
One thing that I'm personally very, very interested in, before I go into your report, apologies that I'm going to start the conversation in this manner, but I know that a lot of Nigerians will want to know, because as soon as that happened, interestingly, you traveled to Maiduguri. I called you to say, let us have the conversation when the malaria vaccines came. Vaccines means something. Malaria is one of the biggest scourge, medical scourge in this part of the world. And when you hear that there is now a vaccine, that's a medical success in trying to curb that kind of disease, now one is going to be glad. What is the percentage of the assurance that when you have the vaccine, you are almost safe from malaria?
Well, the vaccines against malaria are one additional tool that we have to deal with malaria. Many countries were able to eliminate malaria without using vaccines. There are various tools, from bed nets to intermittent presumptive therapy of pregnant women to seasonal chemoprophylaxis and to treatment of those who are already affected. A state like Lagos State has the lowest incidence of malaria. It's an urban state, but it has intervened and case management is widespread. It has less number. But we have one more tool, which is the malaria vaccine, and we're very excited about that, and populations are very excited about that. But to introduce new vaccine, first you have to secure it. You have to get the vaccines delivered, and we have been able to now receive the 1 million doses of the malaria vaccine in our country, and we will begin to roll that out in 2 states, Bayelsa and Kebbi. And the reason is because the vaccines cost money, and you want to be sure that the health workers are trained, that the populations are engaged, that the logistics is straightened up, the arrangements to deal with running the vaccination effort is then, and you learn from it, and then you stepwisely increase it, in addition to finding the fiscal resources, because the vaccines cost resources that have to be appropriated. And in the face of limited resources, choices have to be made. So, but on the private sector side, there may be opportunities for those who can afford it, but for public financing, which is publicly financed vaccines, we have to systematically roll it out. And we're starting with Bayelsa and Kebbi State, and those states are going to be the forerunners, and we'll learn from that and then increase the availability of that vaccine. But even before the vaccines, there are other tools that we have to optimize. Make sure that those who are already affected get treated, that bed nets are widely available, that people use them, and that pregnant women have presumptive therapy as well as seasonal chemoprophylaxis among children who can be protected by that, having sure that we have tests. All of that is part of what we intensified and set up a task force to accelerate Nigeria's malaria elimination effort. And that effort is underway. And when we talk about the report that we'll launch next week, I'll tell you what progress we've had over the last 5 years and how we want to accelerate Nigeria's progress in dealing with malaria to respond to what our citizens are dealing with.
So is the jab for adults or for children?
At this point, I think it's for children. That's the primary target, because the burden of disease is particularly on the children. who are young and who are vulnerable to it. For pregnant women, for instance, they can also be affected, and they will also have complications.
They are within the vulnerable basket here.
But children in particular, they carry a disproportionate burden of malaria morbidity and mortality because they're not immune. You and I have had series of malaria in our lives. More than likely, we have developed some immune response. So you have fever, a few days, aches, uncomfortable as it may be, away from job as it may make us, but we can be treated. But children in particular tend to be most vulnerable, and that's why we're targeting that. Remember, the poorest and the most vulnerable in our population are the first target, and then we go stepwise in that manner.
So the reason why I'm asking that question is that you seem to use Bayelsa and Kebbi as a test case.
Yes.
So in that sense, well, is it a once in a lifetime jab, or it's like hepatitis B that you have to take 3 different layers of jabs for you to be immune to malaria? So imagine that if you get the jab, you are forever immune to malaria.
No,
is that what it means?
No, it's not. So you have multiple doses. That's why we're being very careful in how we roll it out, because it costs, the logistics, the training of the health workers to know who to give, when to give. Those have to be in place.
So it's not once in a lifetime jab?
No, it doesn't give lifelong immunity. That's the question. Like measles, it gives you multiple years of immunity. Yellow fever, 10 years. That's not the case with the malaria vaccine. That's why I said there are various tools. This is one additional tool. It's not magic bullet, but we have to optimize across several tools. And we also have to take into account the subnational, we're a diverse country. Bayelsa is very different from Zamfara. Lagos is very different from Yobe. So the tools that we apply in those places may have to be adapted. That's what we want to learn, because the parasites may not all, they may be malaria parasites, but the vectors, the mosquitoes may be behaving differently in different parts of the country. So we're doing that in a very thoughtful way, but bringing to bear a range of tools to help us accelerate Nigeria's progress on malaria elimination. And end of November this year, we're having some of the world's and the Africa region's best experts coming into Nigeria as advisors for our malaria elimination effort. We call the group AMEN, Advisory Group on Malaria Elimination in Nigeria. And we have a task force that is multi-sectoral, that has private sector, public sector, state governments, and technical expert programmers. But we also need to raise the resources. You cannot eliminate malaria without putting the resources, and that means budget. Federal government needs to do more, and we're looking to do more in 2025, but states also have to prioritize that. That's why the conversations next week around the joint annual review of the health sector is important before we go too far in our budget conversations at the federal level, but also at the state level.
Our capacity to locally produce vaccines is almost dead. I'm not sure if there is any existence of the Nigeria's capacity to locally produce vaccine. I don't know. Pre-COVID and a little bit just after COVID, we were left with no chance of us being able to locally produce vaccine. Has anything changed, Minister?
Significantly. I'm excited with the prospects that I see in the landscape. There's a company, BVNL, which is in Ota, in Ogun State. It has already entered into licensing agreements with an Indian company to start to fill and finish, and then later reverse vertically integrate and be able to produce the APIs here. That company has also engaged with an Indonesian. I don't really want to say too much more, given that some of it may be market sensitive, but I'm very excited that that company is moving forward. There is a second company that is based in Lagos that is also making really important strides. There's a third company that is based in Nasarawa State that is trying their vaccines candidate because a different platform in South Africa. So the advancement we're seeing, the response to the president's policy direction, the executive order that was signed by the president and gazetted into law, which allows for reduction in cost of raw materials and manufacturing equipment, I think is exciting the industry, the pharmaceutical industry, but also the vaccine industry. But remember, this is hard work. If it was easy, it would have been done before. But in the last 1 year, we've begun to see real interest in industry players because we have a large market which could contribute to the African market. So whatever perception you had before 2023, I think I am very excited, the signals they were receiving from the industry, but it doesn't happen overnight. And we're committed to staying the course to ensure.
Trust me, it wasn't only a matter of perception, it's a matter of reality because the nation was in a dire strait medically. We couldn't even produce face masks. It was that bad. And it exposed even the research for medicine in Nigeria. And I know that there is a facility government-owned in Yaba that was moribund at the time. Have you resuscitated it?
That Yaba lab in 2007 was concessioned to the entity that is now in Ota and is now recreating a
privately owned.
The government has ownership and a private entity has ownership. So in a way, bringing private capital, expertise, network with public financing. So it's a jointly owned company based on Ogun State. And we are focused on, and by the way, government also buys some of our routine vaccines through this entity to make it viable. That's sort of the market shaping angle. And there are others that are coming in line. Believe you me, we see a lot of enthusiasm. Folks betting on the future of this industry and this country over the years to come. But it's hard work. It's not easy. It's not transactional. And the business environment may be tough in the short term, but in the medium to longer term, there's optimism.
How soon do you think we can say that on Nigerian soil, we've gotten a locally produced vaccines?
I think 12 to 18 months, you can expect a fill and finish facility. Because remember, you also have to have the regulatory side to be sure that what is produced here is also safe and is efficacious. There are studies that have to go into that. And the last time we produced vaccines here was in the 80s. So we have done 3 decades at least where we were buying from others. And in 1 year or 2 years, we have to be modest in our expectation. But the determination to pursue this course in terms of medical industrialization is, I guess, at this moment, one can say it's irreversible.
Yeah, because
the executive order that the president signed a few months ago, which has now been gazetted, it's really first of its kind, which provides clear policy incentives, not only for vaccines, but for pharmaceutical, for other manufacturers of devices, for test kits, and we're seeing a lot of interest in that direction.
It really bothers the mind when we hear 1 or 2 pharmaceutical companies that used to operate here in Nigeria, they packed and they left
like
the country.
GSK?
Say that
you
again?
say GSK?
Yes, yeah.
Well, I'll tell you this. 2 days ago, the leadership of GSK from Europe were in my office. And they explained to me exactly this point. Last year, there was all hula blue. Oh, they're exiting, they're exiting. They said, look, we are now exploring adaptation of our business model. We cannot ignore the Nigerian market, and they're in the beginning stages of that exploration. In fact, I tweeted that on my handle, the picture that I took with them. And I was very pleased because they have appreciated the president's determination and the actions that he has taken and this government has taken in a very serious-minded way to ensure that our industry, we have 230 million people. Soon we'll be 400 million people in a few years. It will be a very bad business person that will ignore that market. And that market that is in the African continent, which if you produce in Nigeria, you could potentially go to other African markets. So I think the excitement for those who want to build a narrative that Nigeria, people are walking away from Nigeria, well, people can choose to enter and exit. But we have taken steps to ensure that our domestic industry thrives. And those who want to come and invest in Nigeria thrive. And the Federation of Nigerian Pharmaceutical Industry Actors, in fact, were with me that day we spoke in Maiduguri. They donated a container load of pharmaceuticals for the victims of flood. These are local industry players. Why? Because they respect and they appreciate the policy direction of the president.
Because, I mean, it is anybody who does business in this country, we know it's a tough terrain to operate. Either dealing with FX or dealing with ease of doing business, it is a tough task. And I know that it's not an easy task to change things over the night. Anybody who wants to do business in Nigeria will think twice. But we have enormous population, enormous potential. The land is so green and is there for people to come and invest. But a lot of this disappointment gets people upset and they want to just close shop and move away. And that's why I wanted to ask you the question of subsidies, of incentives that could be given to attract and make pharmaceuticals and those manufacturers of medical equipment and medicine to be easier in Nigeria. Is there any of those?
Yes, there are. And first of all, the ease of doing business, I think, is improving. I think the determination of this president and his team, what you will see is that efforts are being done to remove those obstacles. In health sector in particular, for the first time, we have a presidential executive order signed and gazetted by the Attorney General of the Federation, which provides a waiver on taxes and tariffs on raw materials and manufacturing equipment, that provides specific lists of items where those concessions are there, incentives, and supplies demand-side interventions such as market shaping, pooled procurement, to use our purchasing power to support local industry. It's not easy. We're trying to improve, simplify the regulatory system as well so that it's effective, but it's also efficient. All of those, in just a year and a half, we've taken that direction. Believe you me, that is what the market is sensing. When Nigerian industry players move, collect themselves, donate pharmaceuticals, it's because they're happy with where the government is going. When you see GSK coming to say to us, look, we're looking at our business model and we're exploring how we can still get things produced in Nigeria, it's because the reforms are working. We have to stay the course. We have to be very serious-minded on execution. That is what we're doing.
Before I get into the report, and we're anticipating what that would mean, where we have been in the last year or so, and the state of our health sector in Nigeria. I'm bothered, though, when you travel to neighboring countries or countries on the continent, go to Ethiopia, it's difficult for you to buy medications, and there are medications that are classified off the counter that you may not ever be able to get. But you come to Nigeria, every medication in Nigeria is almost on the counter. And it does look like our country has become a dumping ground. In fact, there is a report from NAFDAC warning Nigerians that there are now fake condoms. It's so dangerous now. So you can imagine where there are fake condoms, the disaster that could happen. How has our country become so much of a medical disaster such that fake condoms, fake medications, and anything you can buy, you can just walk into any, they call them chemists, any shop, and just about anybody gets a license to just open shop and start selling medication. So how did we get here?
Well, it's a long story for this country, but I think we're focused on improving the regulatory environment as part of this health sector renewal. NAFDAC, we are supporting to ensure that it's more effective in regulating what comes in. But there are aspects of it that are beyond what NAFDAC regulates. For instance, at the borders, it's not only NAFDAC. Customs and others would have to enforce and ensure that there are those counterfeit medicines and substandard medicines don't get into the market. And then the distribution, we're strengthening NAFDAC's ability to be able to regulate that. Now, the coordinated wholesale centers a few months ago that we activated in Kano that tried to close open drug markets. Not easy, because those who are selling will tell you, oh, we're losing businesses and all of that. But the idea is that you aggregate the wholesalers in one place under supervision and you regulate that more effectively. That is one step that NAFDAC and other entities like Pharmaceutical Council of Nigeria would regulate the premises, the patent medicines. We're working on them to support them to improve on what we're doing. It's imperfect. And as we try to industrialize, we need to have a regulatory system that is up to snuff so that fake and substandard producers will not be what we take to other countries. Believe me, other countries in the sub-region also depend on how to produce here for their own medical needs. Just this week, we had 5 countries in the sub-region who were in Abuja to discuss an effort to improve child mortality. So there are many things that what happens in Nigeria also affects what happened in our sub-region. We're trying to support our regulators to do better. It's not perfect, But that is the journey that we are in to revamp our health sector.
So the fake condoms must have come outside of Nigeria. It's likely to have happened in Nigeria.
Well, I think it's there are things that should not be in our system that actors may find ways to compromise, and those are the minority. Over the years, we've seen reduction in those kinds of things making it. But somebody might hide in their room and create something that is substandard and get it into the market. That is what we're trying to minimize to the bare minimum. And yeah.
Let's talk about the Joint Annual Review, JAR, that is coming. That report is supposed to reveal a lot of things. Perhaps it tells us the status of our health care system in Nigeria, isn't it?
Yes.
But I imagine that something must come before that. The National Demographic and Health Survey,
yes.
You have that?
Yes.
Is it ready?
We do, yes. Let me explain to you. Let me put it in context.
Okay.
When we set up under the privilege of the President, the health sectorial investment, we had 4 pillars. One was governance, to help us reorient the sector to respond to citizens' needs, to be more transparent, more accountable, and to have a compact between federal government, states, development partners, and all actors moving in the same direction. We signed that compact, and we agreed that on an annual basis, we'll review progress and hold ourselves accountable. We have had quarterly performance dialogue with the states, for instance. We have signed with the governors. What will happen next week is a combination of 2 things. The data sources are 2. One is the National Demographic and Household Survey, DHS, which is done every 5 years, 2018 and 2023. The survey was done in October, November 2023 up to December. That asked 46,000 households in Nigeria, different questions, sampled in a way that we can get useful information so that we speak based on facts, not stories. In addition, if you recall, we had a People's Voices survey in 2023 where 2,500 Nigerians were interviewed, asked about their perception. This year, 12 months later, another perception survey was done where 2,600 Nigerians were asked through a sampling method that is rigorous, questions regarding their perception of the health sector. So when you put those 2 together and you disaggregate the results by state, now we can have a conversation that is about performance. We also have commitments that states, federal government, we have done, and we have been tracking them. We will lay them out. 31 out of 41 of those key performance indicators for the sector, by the 3rd quarter of 2024, we have met or exceeded them. But in terms of the DHS, let me share with you, Sean, that there is good news. I know that some may always want to look at the bad news, but there is good news in the Nigerian health sector. We've seen reduction in things like diarrheal diseases by 40%, 30% reduction in lower respiratory infection. We've seen 12% reduction in HIV, 5% reduction in malaria. We've seen a 16.7% in child mortality from 132 per 1,000 children to 110 per 1,000.
Over the last year?
No, not over the last year.
Since 2018?
From 2018 to 2013,
since
2023,
yeah.
December, October, November, December, when the survey was done. This will be further discussed next week, and then the full report with all the data will be made available. There are other elements which are very positive. Model contraceptive prevalence has increased in 17 states, and 6 states in our country have doubled their modern contraceptive rate. Delta, Imo, Nasarawa, Gombe, Ogun, and Ekiti State. That's good news.
So in terms of mortality and morbidity,
yes,
what has changed from the end of 2018 and now?
Yes, so I'm saying child mortality has improved.
Has improved.
Infant mortality has improved. We've seen reduction in diarrheal diseases, lower respiratory infection, HIV, modest reduction in malaria, 5%. We have seen in the last 12 months, the good news also that we would say is very good news. The perception of the sector has improved. Majority, more than half of Nigerians have confidence in terms of the competence of the health sector, health system, and the ability of government to deal with emergencies. That came out in the public perception survey. The not so good news is that the increase that we have seen in access to health, because we did see very positive indication of access to health services. More than 10% increase in checking blood pressure, checking tests for diabetes, in folks having dental checks. Those are indications of utilization. But those increases in access have come at a point where people are paying more out of pocket, and about a third of Nigerian population are at risk of having catastrophic financial expenditure. On the flip side, we have seen increase in insured Nigerians from 16.7 million in 2023 by August to 19.1 million by the third quarter of 2024. So a bump, but by no means the whole range that we should be. And much of that increase came from public insurance, the NHIA and the state health insurance. The private insurance has remained plateaued. And that is why the NHIA is now trying to work on reforms so that we can expand the private sector's insurance of population as well.
I mean, did you hear one of the doctors, the leader of one of the associations, complaining that most the hospitals are now somewhat empty now, because the beds are empty because patients now find it difficult to come to the hospital for treatment because of economic situation in the country. And when you mention insurance, I'm not sure what your data would tell us in the last 3-4 months, because of economic condition, people who are paying out of pocket, the access to health that you mentioned.
Yes.
Did you get that report about how patients are now deserting our hospitals?
Well, you see, there's a difference between a single narrative and a robust data that tells you what the fact is. Yes, one individual, and you can always find those instances. Let me tell you, what we have found from the perception survey of 2,600 Nigerians in this instrument is that more than half Nigerians have a positive view of the sector. And the perception is very positive in terms of the ability of government to deal with emergencies. We have also seen that the numbers of those who have accessed healthcare services has increased in many instances based on this survey, but at the expense of the cost, which is a significant one. Yes, we've seen a bump in those who are insured, and we're just beginning. And we need to do more on health insurance to expand coverage. But mind you, much of the increase is from public insurance, NHIA, the state health insurance. We have to work more on the private insurance. You, for instance, you are a private entity. There are others that are also in the private sector. Let's pull together. Let's have a large enough risk pool. The cost issue is one that is very much bothersome for those of us that are responsible for stewarding the sector. And to reduce the cost to Nigeria's population, in fact, the president approved a medical relief program so that we can procure commodities that can be offered to the poorest and most vulnerable in these difficult times. And that is important, to provide drugs that are of quality to population so that we reduce the burden. But it's a factor of so many pieces as well. Even if you have insurance, the supply of the healthcare has to be there in terms of the training of the health workforce, the equipment, the infrastructure. So there's a demand side, which is the affordability and whether you know what you need to get, but there's also work that has been going on the supply side.
All right. So, I mean, it takes me to, when you're talking about the report, the optics, the perception of the healthcare system in Nigeria, over the last few years, we've seen Nigerian leaders having to leave Nigeria to get treatment. And that's a very sad narrative about our healthcare system. We've failed our country such that our leaders, the number one citizen in this country, we've had a president who have died in office and who are seeking treatment abroad. We're seeing a sitting president who spent several months abroad getting treatment. Is a presidential clinic who functional? Can it take care of the healthcare needs of our leaders?
Sean, I think if there's one thing that I want you and your viewers to take away, is that there's a disconnect between prevailing narrative and facts on the ground. The perception that the elites can just walk away and $2 billion goes out in terms of outbound medical tourism. But when you look closely at our health facilities, federal tertiary institutions that are being revamped, what they are able to do. We have world-class professionals. Some are here in Nigeria and some are Nigerians in diaspora who are coming back here to provide services. But the narrative easily gets built that we don't have anything here, that we don't, and so as if we want to lose respect for ourselves.
But what do we do when our leaders, number one citizen, is not able to get treatment here in Nigeria? What do you do? And I've seen the vice president, former vice president, just for a moment, former vice president had issue with his leg. Professor Yemi Oshibajo, he was treated in Lagos. That is a good one. And look, I know a lot of friends and colleagues who have come back to the country and started practicing. We have a doctor who did a jackpada in the sense that he's an orthopedic surgeon and he's back in the country. Now, those are good stories, and there are more of them. But the question is that when you have a number one citizen, and it's not perception, Minister, President Buhari was out in this country for several months for treatment. And the question is that it's not a perspective.
If I tell you
it's a reality.
There are other senior leaders from other countries in Africa coming to Nigeria for medical care, will you believe that?
I would believe, because I know we have capacity.
So the reason why you don't conflate the quality of our healthcare system and what it has to offer and the choices that individuals can make for various reasons. Some may choose because they've got a provider, they have other things. Tourism is something that everybody has a right to choose wherever he wants to go. And you cannot constrain people. We're not in a communist system where you say, oh, everybody has to be tied.
Well, it's a security of some sort, Minister, when you have your leader not being able to be treated on your own soil. Look, don't you think?
I think there are facilities that are well designed, well structured, properly equipped, and that they have health workers, professionals, doctors, surgeons, pharmacists, nurses that are working very hard to provide those services. Oftentimes, people make choices, but other times, people build on a narrative that nothing works or nothing is good in Nigeria.
Is the State House Clinic effective enough to be able to take care of the healthcare need of our leaders?
I think it is.
Right now?
Yes.
We can put it to test.
You can test.
That's the assurance.
You can test it.
No, you should be able to tell. That should be your number one hospital, isn't it?
I'm telling you.
That should be the number one clinic in Nigeria, isn't it?
Look at the Nigerian population. We're saying that we have a population that has huge inequality within it in terms of access to the most basic services. You started on malaria, on immunization, on pregnant women. Do you get me? On preventing diabetes, hypertension, screening ourselves, looking at cancer. We've seen this administration expanding the cancer infrastructure. 6 of those are underway. 2 will be opened by May. There's never been a time where this has been done. We've seen 10 major infrastructural projects, 8 diagnostic centers that are already underway. I can show you the pictures within 2 months, how much the work has done together with NSIA through MedServe to revamp the infrastructure. You can see teaching hospital. I was at Nnamdi Azikiwe University Hospital in Newi. I was impressed when I saw the infrastructure, the quality of the facilities. I was in Maiduguri recently. Unfortunately, the flood took away a lot of the world-class cancer equipment, which served 6 countries in the region. But it was flooded, and now we're trying to see how we can help them replace them.
Yeah.
So there are good things that are happening in Nigeria.
You need to start projecting them, Minister. So, and you need to make our leaders, maybe if anyone is getting treatment, just to build that confidence that we've got what it takes. And I know I've gotten treatment in this country, and I know the fine medical practitioner in the city of Texas, in the state of Texas, in America. You need to know the number of medical doctors and practitioners that are of Nigerian descent. Even in the UK, I mean, we have a lot of Nigerians,
but you have to
brilliant minds.
You have to respect the privacy of the individual. In healthcare, everyone, whether rich or poor, whether powerful or weak, they have right to privacy of their medical records.
So if a leader decides to go abroad, it's not because we don't have what it takes.
From medical ethics, the patient is king, and the patient has right to his or her privacy. What it should bother you is, as a population, as a health system, are we catering to the poorest and neediest amongst ourselves? Are we preventing mothers from dying due to childbirth? Are we preventing children from dying from preventable causes? That is what this president has put on the table, and we're making progress. Next week, you will hear extensive And it's not perfect. And we have to do more on the affordability. But it's a journey that we have started of transformation, and we will succeed.
You have a huge ambition, isn't it? A very tall one, taller than the tallest basketballer that I know. And you have said that you're working with a state government in an effort to double primary health facilities nationwide. And these are the figures. You said from 8,000 to 17,000 within 3 years. Are we actually on course? How do you want to ensure accountability and state and local government to be brought on board?
Yes. So the accountability piece is easy. Next week, you will see a manifestation of that, where federal government, states, local governments, we will have scorecards for each of the states, how they've performed so far. And we've had performance dialogue. And I think if you go on that logic, for the first time, we have an opportunity to provide a state of health of Nigeria report, which we will submit to His Excellency Mr. President, who has led us this far in this journey, but also will present it to the Senate and to House of Representatives and to Nigerians to have a dialogue. The fact that this is the first time that is happening. It's an important milestone. So I think if we stick with it and remain committed as a country, we can revamp this health sector that it works for everyone, for the wealthy, for the poor and the most vulnerable Nigerians.
Speak to those who are within the system and are bothered that you are probably not building on the building blocks of your predecessors, and there are those who believe that you are starting many initiatives afresh, which could be duplicative and time-wasting. Why is it difficult to build on those existing systems? It seems to be starting a lot afresh.
Well, next week, you will hear from the previous ministers of health who have done important things which laid the foundation for some of the reforms that we are now accelerating. Take the Health Act. It was approved in 2014. 8 years or 10 years later, we're having the first joint annual review and state of the health report. Take Basic Healthcare Provision Fund, which is provided by law. We have done the 5th, 6th, 7th, and 8th meeting of the Ministerial Oversight Committee, and we have released funds to primary healthcare centers, to states for the health insurance program. So we have built on what was working, and we have course-corrected on data. So take data. People throw numbers anyhow. We have now streamlined and said, let's have one source of truth. Let the NDHS guide us. Let it be robust enough. Let's sample. Let's also be able to disaggregate. People's perception. It has never been done. We had one in 2023. We're building. Hopefully, those who come after us would also be able to build on that. That is how systems get built. It's not about individuals, but it's from Lambo and many others, Oshetimehin and others. We're building on the back of that, but accelerating. Because at the same time, Nigeria's expectations is also increasing. Expecting higher standards.
Minister, we have just about less than 60 seconds actually, but there's something I need to, we're talking about policies and actions. In the past, we engaged ministers of health based on doctors' strike. And I would say kudos to you and your ministry for being able to manage that we're not seeing our hospitals being shut. But are those who are also concerned, health regulatory agency workers who say they are being owed many months of salary? Are there assurances that they will be paid? They're facing a lot of hardship.
Yes, and also we appreciate very much. We don't take the healthcare workers for granted. The medical doctors, Johesu, which just called off their strike threat, we engage with them. We're one family. The health of the Nigerian citizen is what is uniting all of us. We may disagree, we may have challenges, but we're working to resolve issues, and we're working to earn each other's trust. And we appreciate the Nigerian healthcare worker, all of the healthcare professionals. We respect them, we appreciate them, and the president is very committed.
Any assurance about the health regulatory agency workers that being owed salaries?
Yes, I think I can assure you that the health regulatory bodies will receive their resources. Mind you, it's an exceptional decision by the president earlier this year that refunded them. Because in the past, there were decisions to defund health regulatory bodies. But given the specificities of health, the president, in his own wisdom, ask for them to be refunded,
right.
to be funded again. And that is good because it protects Nigerians' health and allows the regulatory workers to do their job. They only need to do it efficiently and effectively. Thank you.
Honorable Minister, thank you so much. I wish you the very best. It's a path that a lot of people don't want to tread, but yet if you want the result, we need to do the hard job. And I wish you the very best. Thank you so much,
Thank you,
Honorable Minister for Health, Professor Ali Pate. And that's our conversation for tonight, everyone. And thanks for watching. I'm Sean Kimale. God bless Nigeria.